What is the styloid process? The styloid process is a bony portion presented at the skull base, just anterior to the jugular foramen, and it is attached to the tympanic bone or the inferior surface, and it projects lateral to the medial direction just behind the tonsillar base. So what is the origin of this styloid process? This styloid process gets originated from the second branchial arch cartilage, and that cartilage name is Ricard's cartilage. And this Ricard's cartilage, it forms, for the styloid process, two portions. One is the tympanohyal portion, which forms the proximal portion of this styloid process. Another one is the stylohyal portion, which forms the distal process. So tympanohyal, it usually appears before birth, intrauterine life, and it fuses to the tympanic bone before 1 year age. And stylohyal, it appears after birth, and it fuses to the tympanohyal after puberty. So this is your styloid process, and behind this will be the jugular foramen, and this will be projecting anteromedially just behind the tonsillar base, and this is the stylomastoid foramen. Stylomastoid foramen will be passing the fascia nerve from the mastoid with the tympanomastoid vein and artery, and this whole thing will be covered by the mastoid process, which is present lateral to this styloid process. So there is a pathology which is known as Eagle syndrome. This is basically odynophagia. Patients present with the odynophagia due to the elongated styloid process. How elongated styloid process? Styloid process should be more than 30 millimeter in length to call this diagnosis a Eagle syndrome. And why it gets elongated even after the puberty or just before the puberty? Usually it is thought to be due to the ossification of stylohyoid ligament, which is present between the tip of the styloid to the lesser horn of hyoid. So now we will be talking about the attachments of the styloid process. So what are the attachments of the styloid process? So first, from the inferior portion, inferiorly, there will be a muscle, and behind that there will be a ligament, and from the superior portion, posterolaterally, there will be another muscle, second muscle, which splits into the two portion to get inserted into the lesser horn of hyoid, and this splitted end passes a posterior belly of digastric, and there will be third muscle which is arising from the posteromedial portion of the superior part. And what are the names of these muscles? First one is the styloglossus anteriorly, and from the posterior part this is the stylohyoid getting attached to the hyoid, and third one will be the stylopharyngeus muscle. So these muscles will be supplied by, first, cranial nerve 9 will be supplying the styloglossus, cranial nerve 7 will be supplying the stylohyoid, and the vagus nerve will supply the stylopharyngeus. The stylohyoid ligament we are talking, it passes from the styloid tip to the lesser horn, just where the greater horn is originating. And because of this ligament ossification, the styloid process gets elongated, and it can cause the Eagle syndrome. And above ligament, which is just behind the styloglossus, it is the stylomandibular ligament. So this stylomandibular ligaments gets attached to the angle of mandible.